Prayer and Mental Health, Evidence and Insights, Introduction. Good afternoon, everyone. Today we're going to look at the relationship between prayer and mental health with a special focus on anxiety and depression. While prayer has long been seen as a spiritual practice, recent empirical studies allow us to examine it as a therapeutic tool as well. We'll be focusing on two lines of evidence: clinical trials that tested the effects of person-to-person prayer, interfaith research examining how prayer relates to mental health across Christian, Jewish, and Muslim traditions. 1. Clinical evidence, short-term benefits of prayer. In 2009, Bolins and colleagues conducted one of the first randomized controlled trials on direct person-to-person prayer. Design: participants with depression and anxiety received 6 weekly 1-hour prayer sessions led by a trained prayer minister, while others served as controls. Results: significant reduction in depression and anxiety, increase in optimism and spiritual experiences. Improvements lasted at least 1 month after the sessions ended. Interestingly, stress hormone levels, cortisol, did not change, suggesting the benefits worked through psychological and spiritual pathways, not just biological stress reduction. This shows that prayer can provide measurable improvements in mental health symptoms in the short term. 2. Long-term benefits. 1 year later, a follow-up study in 2012 asked, do these benefits last? 1-year follow-up of the same participants. Results showed that reduced depression and anxiety persisted after a year. Higher optimism and spirituality also remained stable. Some participants even discontinued medication without negative effects. The researchers suggested that prayer may foster self-directed neuroplasticity. In other words, prayer can help rewire the brain by breaking cycles of guilt and rumination and reinforcing positive, hope-filled thought patterns. This makes prayer unique. It is not just a momentary coping mechanism, but potentially a long-term therapeutic practice. 3. Interfaith perspectives, closeness to God as mediator. Not all prayer looks the same. Jepson et al., 2022, compared Christians, Muslims, and Jews to see how different forms of prayer impact mental health. Christians and Muslims, colloquial, personal, and meditative prayers fostered a sense of closeness to God, which in turn predicted better mental health outcomes. Petitionary prayer, asking for things, was less impactful. Jews. All forms of prayer increased closeness to God, but this closeness was not directly linked to mental health outcomes. Suggests Jewish mental health benefits may come more from ritual practice and community observance than from personal prayer. This highlights the importance of religious and cultural context. Prayer's psychological benefits may depend on whether it enhances relational closeness to the divine in that tradition. 4. Mechanisms. How prayer works. From these studies, we can identify several possible mechanisms. Psychological: prayer separates traumatic memories from negative emotions. It helps individuals decenter, creating distance from harmful thought patterns, similar to mindfulness therapy. Spiritual: enhances trust and closeness to God, offering a sense of support beyond oneself. Reinforces hope and forgiveness. Neurological: prayer may stimulate self-directed neuroplasticity, forming new, healthier thought patterns that persist over time. 5. Clinical implications. Prayer can serve as an adjunct to therapy and medication, especially for individuals who are open to religious practice. It may be particularly helpful in reducing anxiety and depression while fostering resilience and optimism. Clinicians should remain sensitive to faith-specific practices. What works in one tradition may not work in another. So, let's wrap up our discussion on prayer and mental health. Prayer helps, both immediately and long-term, to reduce anxiety and depression, and to increase optimism and spiritual well-being. It appears to work through psychological healing, spiritual connection, and even potential rewiring of the brain. But its effects are context-dependent. Faith, tradition, type of prayer, and personal meaning all matter. Prayer, therefore, stands as both a deeply spiritual act and a potentially powerful mental health intervention.